The pathology I had is Meckel's diverticulum. Meckel's diverticulum is the most common malformation of the midgut, and it occurs in about 2 to 3% of the population. It is an outpouching of the ileum wall that formed at about the 6th week of embryological development. It's a remnant of the proximal part of the yolk stalk, the vitelline duct, that failed to degenerate and disappear during the early fetal stage. It can be anywhere from 1 to 12 centimeters, with the average being 5. If it's over 5, it's normally considered giant. It usually contains all the layers of bowel, but about 50% of cases contain heterotrophic tissue like gastric or pancreatic tissue, and that's where some of the problems can occur, because the gastric tissue can secrete acid and create ulcers, which creates bleeding and other issues. Meckel's diverticulum occurs about equally in males and females, but males are more likely to experience the symptoms, and symptoms only occur in a small amount of patients. Up here on the left side, we have signs and symptoms. It can go completely undetected with the patient never having symptoms, but if they do develop, it can be bleeding, which is normally seen in their stool, abdominal pain and cramping, tenderness near the belly button, obstruction of the bowels leading to constipation and bleeding, pain, vomiting, and diarrhea, and diverticulitis, which is swelling of the intestinal wall. If the symptoms are to occur, it's normally during the first year of life, but that can occur later in life as well. And the GI bleeding is usually in like babies and young kids. Down here on the pink one for sonographic appearance, it can't always be detected in utero, but if it is normally a hypoanechoic mass, normally superior and posterior to the bladder. It can appear complex if it is filled with meconium. It won't exhibit flow on color Doppler, so it won't light up with color. And you can see peristalsis within the Meckel's diverticulum. If you see it in a child or an adult, not in utero, it'll be an anechoic tubular structure with a blind ending. It arises from the ileal loops, and it can exhibit the gut signature, which is that 5 layer we learned about, and it'll be found in the right lower quadrant of the abdomen, kind of like the appendicitis, the appendix would look, but it'll be a lot different symptoms. Up here we have prognosis and treatment. It is normally an incidental finding, and it can go undetected a person's whole life if they never had symptoms. If they're experiencing symptoms like bleeding, then the best treatment would be surgery, where they just take it out and then they sew up the bowel that it was taken apart from. After that, there's an excellent prognosis. Like usually it's an easy recovery. The surgery can be done an open abdominal surgery or laparoscopically. After that, they never really have any problems, and they're all good. I'm going to take a close-up to show y'all. This one is, you can see right here, it's a sagittal and a transverse picture, and it's right here, and it's the Meckel's diverticulum filled with meconium, so it doesn't look anechoic. This shows that it can be where it is down here in the right lower quadrant. Over here, this one shows it fetal abdomen at 13 weeks, and you can see the Meckel's diverticulum right there. These ones down here are all for the same case, and you can see it doesn't fill with color. It's not connected to the bladder or the stomach or anything. And then this one is a Meckel's diverticulum in an older patient, like not a fetus. And the red arrow shows the Meckel's diverticulum. And that one is just dilated ileal loops. And I'll do an overview. There's my sources. Thank you all.